Reclining hand to big toe pose. Supta Padangustasana is a leg stretch. Step-by-step instructions. First step, lie on the back, draw the right knee into the chest. Second step, hook onto the big toe of your right foot with the pointer and middle finger of your right hand, or assisted by a yoga strap, and place it in the middle of the foot arch. Third step, straighten the leg upward to the ceiling until the knee is fully straightened. Keep both of your shoulders on the mat. Fourth step, tighten the anterior thigh muscles, active quadriceps, and stretch the hamstrings. While straightening the leg upward, stretch the other leg along the floor with the heel leading the stretch, dorsiflexion of the ankle. Hold this pose for a few long breaths, and then slowly release your right leg to the floor, repeating on the other side. Muscular activity while performing the asana. An intensive stretch in the hamstring of the raised leg, gastrocnemius stretch of the raised leg, plantar flexor stretch of the raised leg, the quadriceps femoris extends the knees, the iliopsoas is stretched. The pelvis is in a slight posterior tilt position, which flattening of the lumbar lordosis. Gastrocnemius stretch of the lower leg. The tibialis anterior muscle dorsiflexes the foot at the ankle joint. The spine maintains contact with the ground. Supta Padangustasana, lateral, to the side variation. From the basic position, hold the foot or use a strap and turn the leg outwards in a lateral rotation. Tighten the muscles that straighten the knee to keep it straight and slowly allow the leg to sink towards the floor on your right side. Flex the elbow and push toward the floor. Spine remains elongated and in contact with the floor throughout the position. Both sides of the pelvis are in contact with the floor. Option to place the left hand on the left hip bone to keep hip pressed towards floor. Stay for 5 more breaths. Bring your leg back to the center and then lower it back to the mat. Repeat on the other side.
Straight leg raise test. A test intended to check the length of the hamstrings. Why is it important to test the length of the hamstrings? Tightness in the hamstrings is common among kyphotic patients. An important part of the overall treatment of kyphosis is lengthening the hamstrings. How do we test them? Lie on the back with legs straight. Raise one straight leg, hip flexion. The tester holds the leg and gently pushes it as far as the range of motion allows, until there is resistance or compensation. It is advisable to support the knee area so that the knee does not flex. How do we know if the hamstrings are tight? The normative range is between 70 and 90 degrees. An angle less than 70 degrees indicates tightness in the hamstrings. An angle more than 90 degrees is excellent. What should be emphasized? One of the compensations people use in rotation to the rear of the hip in order to increase the angle. As soon as the pelvis begins to rotate backward, we stop the test. Now please notice, if the patient experiences static pain when the straight leg is at an angle of between 30 and 70 degrees, then a herniated disc is likely to be the cause of the pain, and the patient could potentially be suffering from a disc herniation. Straight leg raise test. Effective hamstring stretches Part 2. Following the previous video, let's watch some effective stretches. Stretch number 01. hamstring stretch with one leg on chair. A common mistake, spinal flexion with posterior pelvic tilt. The solution is to instruct the trainee to elongate upward. Direct attention to pushing the top of the head upward. It is recommended to add to this stretch additional muscles as gastrocnemius and the plantar fascia through dorsiflexion and toe extension. You can also use the image of a flashlight beam shining forward and upward from the center of the chest bone. Stretch number 02, hamstring stretch with anterior pelvic tilt. The hamstring connects to the pelvis. Therefore, we will tilt the pelvis forward to stretch the hamstring. Stretch number 03, hamstring stretch with trunk flexion through the hip joint. Trunk flexion through the hip joint pulls and stretches the hamstring. Maintain a neutral spine position like you can see on this animation. Stretch number 04, hamstring stretch facing the wall. Tip, lay your foot on a foam roller. Keep a neutral spine position. Stretch number 05, hamstring stretch while seated in a chair. Maintaining the neutral position. Sit on the front edge of the chair. Direct attention to the top of the head, using the image of a flashlight beam shining forward and upward. Stretch number 06, hamstring stretch with 2 chairs. Sit on the front edge of the chair while maintaining a neutral position. Do you have difficulty in maintaining a neutral spine position? Lower your other knee, or bend backward while maintaining a neutral spine position. Stretch number 07, straight leg raise. As the partner, your job is to keep the knee straight and avoid compensation on the other leg or in the pelvis. The partner lengthens the muscle to be stretched to its maximal pain-free end range. Stretch number 08, hamstring stretch with stretching strap. Lift your leg as high as possible, keeping your knee straight.
Common problems. 1. Shortening of the hamstrings in the raised leg. Causes loss of the extended spinal position and creates a bent thoracic pattern, cervical tension, and heightened shoulder girdle muscle tone. In this case, another compensation might be posterior pelvic tilt. Here are some suggestions and possible solutions. A. Perform the position using a yoga strap, wrap it around the middle arch of the foot. The strap should be adjusted to the point that good postural position can be maintained. B. Performing the movement with bent leg on the ground. And C. Support the upper leg with a band. This will allow a more passive position and reduce muscular tension around the shoulder girdle. One more common problem is pelvic raise in the side variation, Supta Padangusthasana, lateral. In this case, the body is turning to the side of the outward leg instead of staying grounded with both sides of the pelvis. First solution is sensory feedback. The exerciser places one hand under the lower back on the opposite side of the raised leg and makes sure that the lower back maintains contact with the palm. Second solution is using a chair under the raised leg for support. With the resistance and support of the chair, the body enables to stabilize equally both sides of the pelvis.